Hello everyone, I am Sandra May Ibanyola from BSN 111A, and today I am going to administer an oral medication for return demonstration. The most common route for medication is orally in the form of capsule, pills, or liquids. The oral medication is the most frequently used route of drug administration, and it is the most convenient, cost effective. Prior to the conduct of procedure, the first thing to do is to check for client's physician order in order to know what medication to be given to the assigned patient. Check for the MAR, drug name, frequency, dosage, and route of administration. So, verify the client's ability to take medication orally. Now, to organize the supply and bring the requisites to the preparation area, the requisites include medicine cup, medicine tray, a dropper, a manometer, and of course the medications that we'll be going to check later, and of course a stethoscope if needed. Yet before all of that, make sure to perform first a hand washing before proceeding to the assessment to protect ourselves and also to the patient from cross-contamination. Read the MAR and take the appropriate medicines. Compare the label medication with the MAR or the computer output. Now retract the label of the medication with the MAR and take note that you have to be cautious with the expiration date. So, for the preparation of the prescribed medication for tablets, pills, or capsule, if it is in a bottle, gently shake the prescribed number into the bottle cover, and if it is in a box top, tap it into the medicine cup. Then place the package dosage of the prescribed amount of the medicine into the medicine cup. For liquid or suspension, shake the bottle if necessary to mix the drug well and to get the right amount dosage of the medicine. Remove the cup upside down and place it upside down to avoid contamination. Hold the medicine cup with your non-dominant hand and use your eye level to clearly see the labels in the medicine cup and use your thumb as the marking level. Slowly pour the prescribed amount of the medicine into the medicine cup. Don't forget to wipe off the rim with tissue or anything so that ants cannot feast on the remaining liquid in the medicine cup. So for drops, press the rubber and draw up the prescribed amount of dosage of the chosen medicine at the eye level again so that you can clearly see the labels here. And insert the dropper in the bottle. Make sure that you have the right amount of the prescribed dosage. Then place the dropper on the medicine cup. So don't forget to review one last time on the MAR to check if there is still medicine that need to be prepared. And also take note for before entering the patient's room number, check first with the room in the MAR or the patient's record. So since we're done, I am going to enter the patient's room. Good afternoon, ma'am. I am Sandra May Ibanyola, your center for today. Can you please take your complete name? Princess Diana. Your birthday and civil status, please? January 2004. Okay, thank you very much, ma'am. But before we proceed, may I ask what should I call you? Diane. Okay, ma'am Diane, at this time, I'll be giving you your medication, which is prescribed by your physician, Dr. Guzman. So, are you aware if you might have any allergies in terms of the medication or drugs? So far, no, I haven't experienced any allergies. Okay, so if the medication is highly acidic, such as the aspirin, it should be given with a snack, such as a cracker or food if it is not contraindicated. Now, at the bedside, I'll be going to match up the MAR with the medication's label. If needed to perform the pre-administration assessment, such as taking the patient's blood pressure, pulse rate, and respiration rate. Okay, Ma'am Diana, I am going to take your blood pressure, respiration rate, and pulse rate first. Is that okay with you? Yes. Okay. So let's start first with your pulse rate. Okay, just relax, breathe in and breathe out. Okay, so I'll be observing your chest area to check for your and head count for your respiratory rate. So just again, breathe in and try to relax. Okay, so. Okay, so let's proceed with your blood pressure. Up your arms, everybody. Discuss the purpose of the medication. Okay, Ma'am Dayan, Dr. De Guzman prescribed here you should take acetylcysteine with a dosage of 500 milligrams to be taken every 8 hours. Since it's in a form of capsule, you need to take it orally. Is that alright with you? Yes, sir. Acetylcysteine is an antibiotic to prevent the bacterial infections such as pneumonia and other chest infection, skin infection, and lastly the urinary tract infection. He also prescribed you with ibuprofen that is to be taken with 5 ml. Since it is a syrup, you'll be taking it every 4 hours. Ibuprofen is used to relieve or reduce fever and body aches, muscle aches, arthritis or menstrual cramps, toothaches, and headaches. So assist the client in a sitting position or lying position. Young Diane, can you please sit up? And adjust, please. Okay, adjust more. Okay. Okay, Ma'am Diane, are you comfortable with the position when taking your medications? Yes, ma'am, I'm comfortable. Administer the medication and give the client a sufficient amount of water, or better if prefer juice to swallow the medicine better. Okay, Ma'am Diane, so is your cephalexin and water. Stay with the client until all the medications have been swallowed. So, here's your ibuprofen. Okay, Ma'am Diane, since you're very good, you have been taking all the medications that your physician prescribed, I'll be going to leave you now. So, in order for you to take your guest, perhaps do you want anything for me to serve you? No. Okay, thank you very much, ma'am. So, thank you so much for your cooperation. Now, I'm done with the administration of the patient, administration of the medication of the patient. I am going to proceed with the documentation process of the procedure which I have just did or done. The documentation would include the type of the medication, the route, and the time it was given. So I've given the patient with 2 types of drug as the physician prescribed. The first one is the antimicrobial or antimicrobial drug that treats bacterial infection, which is taken every 8 hours with 500 milligrams. And the last one is the ibuprofen that's used to relieve the patient's body aches and colds, which is taken by at least every 4 hours with a 5 ml. So don't forget to include the documentation of any complaint of the patient if has, and if ever the medication has been refused, and ask for the reason of the patient's omission. Since we're done with the entire procedure, I'll be going to wash my hands after this so that I can wash off all the contaminations that I have during the procedure. Okay, so that concludes my oral medication.